Today I'm going to show you exactly how to sleep so you wake up with less pain in your back, your neck, your lower back, and actually feel rested in the morning. And just as important, I'm going to show you how not to sleep. Because a lot of people have been sleeping the same way for years and then wonder why they wake up with a headache, why their back is stiff, why they feel like they got hit by a truck even though they slept a full 8 hours. I'm not going to waste your time with complicated theory. I'll show you position by position, mistake by mistake, and the exact correction for each one. Let's start with a position that a whole lot of people sleep in, and most of them have no idea it's making everything worse. If you often wake up with a headache, if your neck is so stiff in the morning you can barely turn it left or right, if your lower back locks up and you spend the first few minutes after getting out of bed hunched over like you're 100 years old, pay close attention. A lot of the time, this right here is the reason: sleeping on your stomach. It feels comfortable when you fall asleep, but look at what's actually happening to your body throughout the entire night. First, the head. You've got to breathe, right? So your neck is turned to one side the entire night. 6, 7, 8 hours twisted in the same position. Look at that angle. One side of the neck is completely stretched out, the muscles elongated to their maximum. The other side is jammed up, the cervical vertebrae compressed against each other. The nerves exiting the cervical spine are pressured for hours on end. Come morning, that neck is inflamed, locked, and painful. And that headache that seems to start at the base of your skull and radiate upward, that's exactly this: compression of the occipital nerves from hours of forced cervical rotation. Next, the lower back. Your belly is the heaviest part of your torso. When you lie face down, it sinks into the mattress like dead weight. And what happens to your lower back? It ends up with an exaggerated curve, a forced hyperlordosis that compresses the intervertebral discs in the lumbar region throughout the entire night. Each disc is like a small gel cushion between the vertebrae. When you force this curve for 6, 7 hours straight, the gel inside the disc gets pushed backward toward the spinal nerves. Over time, this can cause protrusions and herniated discs. That pain that shoots down the leg, the famous sciatica, it often starts like this, slowly, night after night, disc after disc being pushed out of position. Third, breathing. In this position, your entire body weight presses your chest into the mattress. Your lungs can't fully expand. Breathing stays shallow all night. Your body receives less oxygen. Sleep becomes less restorative. The brain doesn't perform its overnight cleaning properly. That's why you can sleep 8 hours on your stomach and wake up feeling more tired than when you lay down. If you're a stomach sleeper, I understand it's hard to change. Sleep habits are among the most deeply ingrained habits we have. But try falling asleep in a different position. Even if you roll onto your stomach during the night unconsciously, getting those first 2 or 3 hours in a better position significantly reduces the load on your spine and neck. And right here, I need to stop and tell you something that could change everything. Because what I'm about to teach you covers the mechanical side of sleep pain. But there's a layer that most doctors completely ignore: the chronic inflammation in your tissues that makes you wake up stiff and sore even when your position is perfect. I see it every week. Patients who've spent thousands on orthopedic mattresses and memory foam pillows, who do physical therapy 3 times a week, who take anti-inflammatories every night before bed, and they still wake up stiff, locked, in pain. Because no mattress in the world fixes inflammation. No pillow fixes inflammation. And chemical anti-inflammatories mask the pain while destroying the stomach, kidneys, and heart. That's exactly why CardioShield is different from anything else I've seen. This natural formula with hawthorn leaf, olive leaf extract, green tea, and garlic fights the chronic inflammation that causes morning stiffness and pain at its source. It supports healthy blood flow to joints, muscles, and intervertebral discs during the critical overnight recovery hours when your body is supposed to be repairing itself. When inflammation is lower, tissues repair properly, discs rehydrate, cartilage receives nutrients, and you wake up feeling like a completely different person. I can only help the first 5 people who act right now. More than 200 people have already checked it out and the results are staggering. Doctor, I spent $4,000 on an orthopedic mattress and still woke up in pain every morning. After adding CardioShield, the morning stiffness disappeared in 3 weeks. My orthopedist asked what I changed because my MRI showed less disc inflammation. They call it a miracle product. Link in the first pinned comment. 180-day guarantee, 0 risk. Go now. Disclaimer, not a substitute for medical care. Now let's talk about sleeping on your side. This is the most common position and the one most people think they're doing correctly, but are actually making at least 2 or 3 mistakes that destroy the benefit entirely. Right off the bat, here's who needs to really listen up. If you get pain in your hip, if the outside of your thigh aches when you lie down, if your lower back is stiff every single morning, if you deal with heartburn or acid reflux, this part is especially for you. First, which side should you sleep on? If heartburn or acid reflux is an issue, try to fall asleep on your left side. The reason is anatomical and simple. Your stomach sits on the left side of your body. When you lie on your left, the valve between your stomach and your esophagus, called the lower esophageal sphincter, ends up positioned above the level of your stomach contents. This means gravity works in your favor, keeping acid inside the stomach where it belongs. Lie on your right side and it's the opposite. The valve sits below the level of the contents, and acid has a free path upward into the esophagus. Simple thing that can eliminate years of nighttime reflux without any medication. And obviously, if one shoulder or one hip hurts, sleep on the other side so you're not pressing on the sore spot all night. Seems obvious, but it's remarkable how many people sleep on the painful side and then wonder why it gets worse. 3 key areas that almost everyone gets wrong when sleeping on their side. For each one, I'll show you the mistake and then the exact correction. Area 1, neck and pillow. This is perhaps the most common and most devastating mistake. With a pillow that's too thick, the head is pushed upward. The neck bends at a lateral angle that compresses vertebrae on one side and stretches ligaments on the other. The nerves exiting between the cervical vertebrae get pinched. Sleep like that all night and your neck will be screaming at you by morning. Guaranteed. This is one of the most common causes of the stiff neck that people attribute to sleeping wrong without understanding the pillow was the problem. With a pillow that's too thin, the head drops toward the mattress. The neck kinks in the opposite direction. Same compression, different angle. Same pain in the morning. What you want is for the pillow to fill exactly the space between your shoulder and your head so that your head is basically a straight continuation of your spine. Not tilted up, not dropping down. A straight line from hip to the top of your head. Practical tip that costs nothing. Grab a regular bath towel, fold it up, and slide it under your pillow. Need it a little higher? Add a fold. Too high? Take one away. You can dial in the height with millimeter precision without spending a cent on a specialty pillow. Area 2. Lower back and waist. This is the one that almost everybody misses and almost nobody knows about. And it's one of the main reasons people who sleep on their side wake up with a sore lower back even with a good pillow and an expensive mattress. Look at the anatomy. Your shoulders are wide, your hips are wide, but your waist in between is considerably narrower. When you lie on your side, the waist area has no support. It sags toward the mattress. Your lower back hangs like that all night, curved laterally for 6, 7, 8 hours straight. The discs are compressed on one side and stretched on the other. The paraspinal muscles go into spasm trying to stabilize. By morning, lower back pain. And people blame the mattress. The fix is ridiculously simple. Take a thin pillow, a folded towel, or even a rolled-up t-shirt and tuck it under your waist between your ribs and your hip. Fill that empty space. Look at the difference. The lower back is supported now. The spine is straight when viewed from behind. The muscles can relax. The discs aren't being compressed laterally. Simple adjustment, morning-changing result. Area 3, knees and hip. If you get pain in your hip on the outside of your thigh, especially that pain doctors call trochanteric bursitis, or if it takes you a while to get moving in the morning with hip stiffness, listen carefully because this is often the missing piece. When that top leg just lies there unsupported, its weight pulls your pelvis down toward the mattress. The pelvis tilts, rotates, and drags your lower back with it, creating torsion. The gluteal muscles and tensor fascia lata get stretched and pressed against the greater trochanter of the femur, that bony prominence on the outside of the hip. Hours in this pressure cause inflammation of the bursa, the fluid-filled sac that protects the bone. Result? Trochanteric bursitis, that stabbing pain on the side of the hip. Plus, your knees are pressing bone against bone all night. The cartilage doesn't appreciate it. Put a pillow between your knees. Look at what changes. The legs are parallel. The pelvis is level, no tilting. The lower back isn't twisted. The hip isn't being compressed. Patients with hip pain for months tell me the pain decreased by half in just 1 week with the pillow between the knees. Side sleeping summary. Proper pillow under the head maintaining straight spine alignment, thin support under the waist to prevent lateral lumbar flexion, and a pillow between the knees to level the pelvis and protect the hip. 3 support points and the body is aligned as it should be. And here I cannot continue without interrupting, because the positions fix mechanical pain. But most people over 50 have a layer of chronic tissue inflammation that no sleeping position resolves. This inflammation comes from inadequate nutrition, chronic stress, lack of specific nutrients that connective tissues need, chronic dehydration that makes intervertebral discs dry and brittle, and excess medications that overload the liver and keep the body in permanent inflammatory state. You can sleep in the perfect position with the best supports in the world and still wake up stiff and sore if tissue inflammation is high. The body uses the night for repair, but if the internal environment is inflamed, repair doesn't happen properly. This is exactly what CardioShield addresses. Instead of masking inflammation with chemicals that damage your organs, it fights inflammation at the source with hawthorn leaf supporting cardiovascular function, so oxygen and nutrients actually reach your joints and discs during sleep. Olive leaf extract combating the tissue inflammation that stiffens everything overnight. Green tea, one of nature's most powerful anti-inflammatories, protecting tissues during the critical repair window. Garlic maintaining the healthy blood flow your body needs for genuine overnight recovery. More than 200 people have experienced the difference. People who combined proper sleep positions with CardioShield and saw results that left their doctors speechless. "Doctor, I thought back pain was just what happens when you get old. After CardioShield, I discovered it was treatable inflammation. I wake up pain-free for the first time in a decade. I dropped the muscle relaxant and anti-inflammatory I took every night for 6 years. My doctor approved because my labs improved. Miracle product. Only 5 first people. Link in first pinned comment. 180-day guarantee. 0 risk. Every night of inflammation is another night of tissue damage. Disclaimer, not a substitute for medical care. Now sleeping on your back. And I've got one simple trick here that takes the pressure off your lower back almost instantly. If your lower back bothers you, especially in the morning, if the first few minutes after getting up you just can't straighten out, if you get that stiff, locked up feeling all along your spine, if your shoulders or shoulder blades ache, sleeping on your back might be the best option, but only if you do it the right way. Pillow too thick. The head is pushed forward, chin jammed into the chest. It's like spending 6 hours staring at your phone. The cervical spine loses its natural curve and gets forced into flexion. The posterior neck muscles are stretched to maximum. The anterior muscles shorten. By morning, nuchal pain, cervical stiffness, and often tension headaches. Pillow too thin. The head drops back, the neck overextends. The cervical facet joints get compressed. Can cause neck pain and even arm tingling if nerve roots are compressed. What you want is a pillow that supports your neck without pushing your head forward. Face pointing straight at the ceiling. Neck maintaining its natural lordotic curve. Valuable tip. Roll up a small hand towel and place it inside the lower part of your pillowcase, right where your neck sits. This creates a cylindrical support that fills the cervical curve from underneath, providing support exactly where needed. The difference is felt instantly. Now the trick that changes everything and that almost nobody knows about. When you lie on your back with your legs fully extended, there's a significant gap under your lower back. You can fit your entire hand in there. This gap exists because the front thigh muscles, especially the iliopsoas and rectus femoris, when legs are straight, pull the pelvis forward and force the lumbar spine into hyperlordosis. The lumbar discs get compressed posteriorly. The paraspinal musculature stays in constant contraction trying to stabilize. That's 6, 7, 8 hours of compressive load on the lower lumbar discs, L4, L5, and L5S1, which are exactly the discs most prone to herniation. Now watch what happens when you place a pillow or rolled blanket under your knees. The knees bend slightly. The iliopsoas and rectus femoris relax immediately. The pelvis returns to neutral position. The lower back drops toward the mattress. The gap disappears. The lumbar curve becomes natural, not excessive. Discs are decompressed. Musculature can finally relax. It takes 5 seconds to set up. People who try this for the first time come back and say, "Why did nobody ever tell me this before? It's so simple." If you've got a sore shoulder, don't put your arm behind your head. That position compresses the rotator cuff against the acromion and can cause or worsen supraspinatus tendinitis. Also, don't let the arm lie flat along your body because that maintains the shoulder in forced internal rotation. Instead, set a small pillow next to you under your arm. The arm is slightly elevated, elbow a little away from the body, hand resting on the pillow. The shoulder sits in neutral position without compression or forced rotation. Comfort difference is immediate. 4 golden tips to complete the transformation. Tip 1. The 3-point check before lights out. Takes 3 seconds and can prevent 8 hours of pain. Before closing your eyes, quick check. Is my neck supported and aligned with my spine? Is my lower back not sagging or arching excessively? Are my knees in the right position, with a pillow between them if I'm on my side or under them if I'm on my back? 3 questions, 3 seconds. Make it a nightly ritual like brushing your teeth. After a week, it becomes automatic. Tip 2. For those with that nagging pain on the outside of the hip, if you keep getting that ache right on the side, just above the hip joint, that hurts to lie on and sometimes radiates down the outer thigh, try this before bed. Grab a tennis ball. Lie on your side on a firm surface. The floor works great. Place the ball under your gluteal muscle. Not on the bone itself, on the muscle a little bit above and behind the hip prominence. That's the gluteus medius and the deep hip rotators that get tense and go into spasm. Slowly roll around and look for sore spots. When you find one, and you will find several, hold it there for 30 to 60 seconds. The sustained pressure activates a neurological reflex called autogenic inhibition that forces the muscle to relax. Same principle physiotherapists use with myofascial release. You might be amazed at how much relief you get, often from the very first session. Important rule: never press the ball into the bone. Work the muscles only. If the pain is sharp, like a stabbing sensation, ease up on the pressure. The sensation should be good pain, the kind that feels like it's doing something beneficial. Tip 3. A simple lower back stretch before bed. Lie on your back on the floor or bed. Pull both knees up to your chest. Wrap your arms around them and gently rock side to side like a little boat. 30 seconds to a minute. This movement does several things simultaneously. It stretches the lumbar extensor muscles that have been contracted all day. Opens the spaces between vertebrae, decompressing discs. Mobilizes the facet joints that tend to lock up. And activates the parasympathetic nervous system, which is the relaxation and repair mode. Do this every night before getting into bed. Give it a week and you'll notice how much easier it is to fall asleep and how much better your back feels in the morning. Simple, free, takes under a minute. Tip 4. Don't eat a heavy meal within 2 hours of bedtime. A full stomach makes every sleeping position uncomfortable, especially on your side or back. The pressure of a distended stomach pushes the diaphragm upward, making it harder for the lungs to expand. Breathing gets compromised. Sleep stays more shallow. And if you deal with heartburn, a late dinner practically guarantees a rough night regardless of which side you lie on. Give your body at least 2 hours for initial digestion before lying down. Let's wrap this up. Stomach sleeping. Try to move away from it. Twisted neck, arched lower back, compromised breathing. Side sleeping. A pillow at the right height that keeps the spine straight, thin support under the waist to prevent lateral flexion. Pillow between the knees to level the pelvis. If you get heartburn, left side. Back sleeping, a pillow that supports the neck in its natural curve, small rolled towel in the lower part of the pillowcase, and absolutely a pillow under the knees to decompress the lower back. Try just one thing from this video tonight. Tomorrow morning, feel the difference. Share this video with someone who needs it. Your mom, your dad, a friend, a neighbor. Because sleeping without pain isn't a luxury. It's something everybody can get back. I'm Dr. James Carter. Take care of your spine. It's the only one you've got.